I've got a lot of questions about LASIK lately, so today we're going to talk about laser eye surgery, what types there are, and who might be a candidate for the right procedure. Now, I say laser eye surgery because there are actually many different types of surgical correction out there to make it so that you don't have to wear glasses or contact lenses. There's LASIK, that's the most commonly known and performed procedure. But there's also PRK, there's SMILE, and there's ICL. So we're going to talk about all of these, the advantages and disadvantages, and also some potential complications of each one. So the first procedure that we'll talk about is LASIK. The acronym actually stands for Laser Assisted In Situ Keratomileusis. Now, LASIK is a procedure that's performed on the cornea, or the front part of the eye. Now, that cornea actually has thickness like a book. So what they do during the procedure is they open the front cover, they take out a few pages, and then they close the front cover back down. Now, with LASIK surgery, that flap that's created is actually made by a laser. Now, there's another type of surgery called PRK, also stands for photorefractive keratectomy. This procedure is very similar to LASIK. However, the flap, instead of an actual mechanical flap being created, the top layer of skin cells is removed with an alcohol solution, and then the underlying stroma or the central bed of the cornea is treated with the laser. The last and newest procedure is called SMILE, which stands for small incision lenticle extraction. Now, in this procedure, a small incision is made on the front part of the eye, the cornea, with that laser. And then a small area of central cornea or central stroma is then removed from that incision in order to correct your vision. That's a lot of different procedures. Now, before we even send you for a consultation, there's a few things that we have to determine in advance to ensure that you might be a good candidate for the surgery. Now, the first thing is if your prescription is not stable, you would not be a good candidate for the procedure. We typically recommend that your prescription be stable for at least 1 to 2 years. The longer, the better. Now, you have to also be at least 18 years old. We are now finding that sometimes prescriptions are stabilizing a little bit later into your 20s. So I typically don't encourage patients who are 18 to rush into it. I typically recommend waiting a little bit longer. Some surgeons might even require you to wait until you're 21 years of age. The next thing we have to ensure is that there's no underlying eye conditions that might disqualify you from being a candidate. If you have severe dry eye, if you have severe blepharitis, meibomian gland dysfunction, those are things that actually need to be treated before you go into surgery. Dry eye in and of itself, although it can get worse after the procedure, it doesn't automatically disqualify you. Typically, I like to maximize the ocular surface prior to sending a patient for LASIK to ensure that they have the best outcome. Now, some general considerations include your overall health. Are you in good health, or do you have any underlying conditions such as diabetes or an autoimmune condition like lupus or rheumatoid arthritis that might make it a little more difficult for you to heal after the procedure? Delayed healing can actually result in complications with the flap that's created during the procedure. Also, conditions like diabetes, in which your vision can fluctuate as a result of the disease. If we treat you with a laser and then your prescription changes afterward, it really negates the results of your procedure. So we wouldn't want that to happen. Some other considerations include which type of medications you're taking. Certain medications like Accutane that can cause severe dry eye. While you're on the course of that medication, we wouldn't recommend going for the procedure. Also, if you are pregnant or nursing, the fluctuations in your hormones can actually alter the measurements, and so we wouldn't send you for the procedure at that time. We would wait until you're done being pregnant and done nursing. Okay, so now let's dive into the 3 different types of corneal refractive surgeries: LASIK versus PRK versus SMILE, and why you might want to go with one or a different procedure. Now, LASIK is the most commonly performed procedure. Typically, the visual recovery is very fast. You pretty much get up off the table and you can see great. You sleep through the healing process overnight, and you're actually able to drive yourself into your 1-day post-op the next day. Typically, when I see my 1-day post-op patients, they are in love with their new vision. They reported a little bit of discomfort leaving the surgery center that resolved overnight, and they report great vision in the morning. Now, PRK is a little bit of a different procedure. Again, that's the procedure where we use an alcohol solution to remove the top layer of skin cells and then treat the underlying cornea with the laser. Now, in that procedure, There is a bandaged contact lens that's placed on the eye afterward that helps promote epithelial cell healing underneath that bandaged contact lens. Afterward, we do give you a little bit of pain medication to help you get through the night, and then I see you at the 1 day next day. Typically at the 1 day for PRK, patients are a little bit more uncomfortable. There's a little bit more discomfort involved, a little bit more light sensitivity. That discomfort lasts about 2 to 3 days, and the visual recovery is not as fast as LASIK. So by day 1, you're about 20/40, and then achieving 20/20 can take a little bit longer than it does in LASIK. Now, eventually, over about the first month, you will achieve that 20/20 vision that you do after your LASIK procedure. It just is a little bit delayed. Now, it's not that you can't see after the procedure. The vision is just a little bit foggy initially, and then it will resolve over time. So you might be thinking to yourself, well, why would I ever go for PRK? It sounds a little bit more uncomfortable. I want to get up off the table and I want to see. I don't want to have to go through the discomfort. A couple of things might make us err towards PRK. And the first thing is, if your cornea is actually too thin to treat with LASIK, then we would move to PRK. PRK is a great option for patients who are candidates, but their cornea is just a little bit too thin. In that case, it's a little bit safer, and we do educate you on the risks or the discomfort that you will experience afterward. Typically, it's not something where patients have gone through the procedure and they say, oh, that's terrible, I would never go through that again. It's just, again, a little bit of discomfort in the early stages. The second thing is, if you play any contact sports like boxing or any type of martial arts, that typically is a contraindication for LASIK. We would not want to create a flap on the front part of the eye, because in the event of an injury to the eye, even years later, that flap can actually dislodge. So just for safety reasons, we would encourage patients to go for PRK over LASIK, just so they don't have to have that flap created. Some branches of the military also require PRK in order to serve in that branch. So if you are interested in one of those, interested in enlisting, you might not actually be a candidate for LASIK as a result of those requirements. Now, as with any surgery, there's always a risk. There's always a risk of complications after the procedure. Typically, the side effects that we most commonly see from LASIK are dry eye and glare and halos. Those typically subside over the first 1 to 3 months. Oftentimes my patients will come in at the 1 day mark and say they feel a little scratchy, and they also notice a lot of glare and halos at nighttime. And when I see them at the 1 week mark, they've reported that those symptoms have significantly diminished. Other complications can possibly include infection or over-treatment and under-treatment. We do minimize the risk of infection and inflammation by giving you an anti-inflammatory drop and an antibiotic after the procedure. Also, we minimize any dry eye using artificial tears and other methods to treat your dry eye after the procedure. I typically have my patients use the artificial tears or lubricating drops pretty frequently after the procedure, because during the procedure, once that flap is created and they sever the corneal nerves don't send a feedback signal to your brain telling your brain that the eyes are dry, so we have to manually lubricate our eyes for themselves for the first couple of months until those nerves regenerate. Now, according to the American Refractive Surgery Council, there have never been any reported cases of anyone going blind from the procedure. The procedure itself actually has a 96% success rate. The rate of complications is fairly low, and there's actually a higher rate of complications with extended wear contact lens modalities than there are with LASIK. That being said, there's always a risk of potentially visually devastating conditions after a procedure like LASIK. One of those complications is known as post-LASIK ectasia, and that's a condition in which the cornea continues or progressively thins and bulges forward and causes high levels of nearsightedness and irregular astigmatism that result in visual distortions, meaning you don't see as well, and it can't be treated with traditional glasses or contact lenses. This is typically the result of over-treatment with the laser. So if you have too high of a prescription and you don't have enough corneal thickness, if the surgeon is trying to remove too much corneal thickness, that is, and you're not left with enough cornea at the end, you're not left with enough residual cornea after the procedure is completed, that's something that is known to trigger this complication. Now, the rates of this have significantly diminished over the last several years because we are so much better and more advanced at screening for your corneal thickness now than before. We are also a lot more advanced in identifying levels of irregular or astigmatism prior to going for the procedure, because that's also a known risk factor for triggering post-LASIK ectasia. The second very visually devastating complication that does arise occasionally is known as neuropathic corneal pain. Now, we're not quite sure what triggers neuropathic corneal pain at this time, and it is a very rare complication, but it is something that can happen after one of these procedures. I want to expand a little bit more about LASIK because that's the procedure that most of my patients come in asking about, and that's the procedure that most will select when they are deciding on which refractive procedure is right for them. Now, LASIK itself is actually less than a minute per eye. Less than 1 minute per eye. It is so fast, you are up off the table before you can even think about it. Now, during the procedure, the surgeon will use an instrument called a lid speculum to hold your eyelids apart. They'll administer a lot of numbing drops so that you don't have the sensation to blink. The laser has an eye tracker on it, and the surgeon can physically hold your eye if he needs to. Most of my patients ask, well, I'm going to blink, I'm going to mess it up. We make it so that you can't blink. There's no possibility of you blinking during the procedure. And if anything were to happen, as if you were to look away, the laser will stop. Now, the newest player in terms of corneal refractive surgeries is SMILE, or small incision lenticule extraction, which is where the surgeon makes a small incision and then removes some of that central tissue. Now, SMILE is thought to be a little bit less invasive and can potentially cause less complications with dryness after the procedure. However, it has some limitations over PRK and LASIK in that it can only treat nearsightedness and it can't treat levels of astigmatism. It can only treat up to about half a diopter of astigmatism, whereas PRK and LASIK can treat much more than that. So SMILE has its limitations, although it might have its pros for some patients who are looking to potentially avoid dry eye after the procedure. So we've covered a lot of ins and outs of refractive corneal surgeries to correct your vision, but there's one more that we've left out, and that's ICL, or implantable Collamer lens. You might also know it as implantable contact lens. Now, that procedure is where the corneal surgeon will implant a lens inside the eye in front of your natural lens in order to improve the vision. Typically, we would recommend this procedure for somebody who's not a candidate for LASIK or PRK. Let's say you have a really high prescription or you have too thin of a cornea for either LASIK or PRK. Those would be indications that we might want to select an ICL. So if you're thinking to yourself, my prescription's way too high for LASIK, there's no way I would ever be a candidate, there's actually this alternative that might be right for you. Any type of refractive surgery that you invest in is a big investment in time as well as financially. Time-wise, although the procedure itself is pretty fast and the visual recovery is as well, you are committed to coming to your post-op appointments. We see you 1 day after the procedure, 1 week, 1 month, 3 months after the procedure, and maybe at 6 months, just depending on your stability at the 3-month mark. Now, a lot of patients do ask, is it stable? Is it permanent? Am I going to need a touch-up in about 10 years? And the answer to that is LASIK is permanent. Some of the prescriptions that we can treat with LASIK do have, or PRK, they do have less predictable results. Typically, moderate to high levels of hyperopic LASIK or farsighted LASIK, they tend to have less predictable results and can result in regression or a changing of the prescription after the fact. Sometimes as well with treating high degrees of nearsightedness with LASIK or PRK, like a -9, 10, 11, those tend to result in a little bit of an undercorrection in the beginning and might require a touch-up. Oftentimes the surgeon will offer a touch-up for free. Sometimes they'll even offer a lifetime guarantee on the procedure where they will touch it up for free in the event that you do have enough corneal thickness for the surgeon to go back in and remove more tissue. Any changes that I see in your prescription about 10 years into the future typically are the result of lenticular changes or changes to the lens inside the eye, not to the cornea on the front part of the eye where you were treated with LASIK or PRK. Those lenticular changes typically result in maybe a slight level of nearsightedness where you're fine during the day and you might require some glasses correction at nighttime for driving, or you might require reading glasses. Last but not least, how much does it cost? Now, this depends on your specific area that you're in, as well as what technology is being used, but typically any laser refractive procedure will cost around $3,800 to $5,000, give or take. Now, the good news is most surgery centers do have payment plans where you can pay this off over time. 1 to 2 years depending on what you qualify for, and it's typically covered interest-free. And some insurance companies are actually offering a laser vision discount where they'll offer you 10-20% off the surgery depending on what you signed up for at open enrollment. So you have to check your specific vision plan. So I hope this helps answer some of the questions you might have surrounding laser vision correction, what types of procedures are out there, what to expect before and after the procedure. If there's something that I missed, please drop it in the comments below. And if there's any other types of videos you'd like to see, please let me know what topics you're interested in covering, and make sure you subscribe.